The Affordable Care Act, or Obamacare, is one of the most defining policies of Obama's presidency. It promises to ensure millions of Americans without health care by March 2014, and is a healthcare overhaul that no other president has accomplished. Since its October 1st launch, there have been numerous problems that have surrounded the policy: a government shutdown, problems with the Affordable Health Care website, healthcare.gov, and now millions of Americans across the country who are losing their current health care coverages because they do not meet the standards set by the Affordable Care Act. This week, the Obama administration is set to release numbers on how many Americans they have enrolled, and Republicans, as well as many opponents of the bill, are already predicting that the number will be low. 2014 elections are just around the corner, and Democrats are now scrambling to defend their seats for the election. Joining us today is AU government professor James Thurber, who is director and founder of the Center for Congressional Presidential Studies. He has served as a legislative assistant for a handful of U.S. senators and has also worked with President Obama on ethics and lobbying reform. Thank you so much for joining us today.
It's good to be here.
So, I would like to know, when the numbers come out this week of how many people are enrolled for the Affordable Care Act, and if they are low, what should the Obama administration do to, repair their image?
They should worry, because politically this is a very potent thing. They have a pool of 47 million people that need to be enrolled. They probably will only have a couple million. They have technical problems, they have political problems. The House of Representatives has tried to do away with the Affordable Care Act, or so-called Obamacare, 44 times. They just did it again yesterday. It doesn't go anywhere in the Senate. In some states, it's going very well. State of Washington, Connecticut, they run their own pool, and the sign-up is going easily. It's in those other states that don't like it that have the federal government doing it, and they're overwhelmed with the demand for people wanting to get insurance. I think once they get the insurance, they're going to be very satisfied, but it's going to be a rocky road for the president, for the Democrats, and for those trying to get on for a few months.
Sure. So by this time next year, I think it's 435 House seats and 33 Senate seats will have been determined. What are these Democratic senators and congressmen that are up for re-election? What will they need to do to, win these seats?
Well, the Obamacare is a potent issue in very conservative districts. There are only 50 districts out of 435 in the House of Representatives that are competitive. This issue, as well as the capacity of the Republicans to govern, as well as the debt and the deficit, will be part of the major issues in that campaign. There are only 10 seats in the Senate that are competitive. 8 are Democrats, 2 are Republicans, and shutting down government is hurt in those competitive districts for the Republicans in the House and the Senate, but Obamacare is hurting very much also. So this thing has to get rolling, be successful in a very short period of time, or it will have an impact on that election.
Sure. How do you think, the Democrats can steer away from this narrative that the GOP has created, that Obamacare has been a failure since the start? How do you think they can repair their image?
By reframing the issues associated with the ACA. There are many things in there that the American people like people who have pre-existing conditions can now get insurance. Children could a couple years ago. Now, as of January 1, adults can. That's very important. It also is going to reduce the cost of health care, increase access to health care. They need to get their message straight. They need to have a clear strategy, theme, and message about what it does good for the American public. They're not doing that yet. The president's not selling it very well yet. They need to improve that.
Sure. And do you think it's fair to extend the deadline, the March 31st deadline, to enroll everyone for the Affordable Care Act? Do you think this is a fair deal?
Well, I think that they do extend it. It should be announced a little bit later, but I think it's a reasonable thing since the computer sites are failing right now in terms of people being able to enroll. The real question is all those letters that went out to people who said you no longer have insurance, and the president says you can keep your insurance, period, and it turns out that's wrong. He's apologized for it, and that was a major hit for the Democrats and the president.
Sure. Okay, well, thank you so much for joining us, Professor Thurber. We really appreciate your time.
Thank you.
Thank you for joining us today for our health edition at District Wire News. I'm Sydney Kashiwagi.
And I'm Isabella Diaz. For more information, check us out at dcwirenews.com.